Good morning, Bill Brooks. How you doing? Hey, I wanted to update you guys on health reform, which takes effect January 1, 2014. Individuals without insurance will owe a tax. Although the Obama administration delayed to 2015 the rules that firms with 50 or more full-time employees must provide health insurance to workers or pay a stiff fine, the individual mandate start date wasn't deferred. So it's January 1, 2014. So here's going to be kind of an update on what's to be expected. The IRS has issued rules on this when the tax applies. It's called the tax, so it's basically in lieu of not having adequate insurance. So folks must have minimum essential coverage for themselves and their dependents to avoid the tax. This includes coverage provided by an employer that meets minimum federal requirements, coverage purchased through an exchange, and federal coverage such as Medicare, Medicaid, TRICARE, and veterans coverage. Several groups of people are exempted from the individual mandate. For instance, individuals for whom coverage is too expensive. That's determined if the employee is eligible for coverage, but his or her share of the premium exceeds 8% of the household's adjusted gross income. Then the penalty tax doesn't apply. The same thing for folks who are ineligible for employer coverage if the cost of a basic bronze level plan in an exchange, less any federal tax credit for buying insurance, exceeds 8% of the household's adjusted gross income. Members of the households where total income is below the level needed to file a tax return are also exempted. That's $9,750 for singles, $19,500 for joint married filing joints, and $12,500 for heads of household. So if the adjusted gross income is less than that amount, then coverage is not required. Also, the following are exempted from the penalty tax: filers who go without coverage for periods of less than 3 months, people who can show that a hardship forced them to go without coverage, and members of religious groups opposed to private or public insurance. The tax for being uninsured is normally the higher of two amounts. So the first amount to consider is the basic penalty or an income tax-based levy. The basic penalty is $95 a person for 2014, which is, by the way, going to go up in 2015 and 16, and $47.50 for each family member under the age of 18, with a $285 ceiling. That's for 2014. So it's the higher of two amounts. The other amount to consider in this calculation is the income-based penalty is 1% of the excess of the taxpayer's household's adjusted gross income over the minimum level of adjusted gross income needed to file a tax return. So basically, the higher your income, the more likely you're going to have a penalty, and it could be 1% of this excess over the adjusted gross income. In either case, the tax is reduced proportionately for any months that the taxpayer had coverage. But in no case can the tax exceed the cost of a bronze level exchange plan for the taxpayer and family members, also adjusted for months with health coverage. It's kind of confusing, isn't it? This all is going to be made more clear as we move into this. So this tax is paid annually on the 1040. So for 2014, the tax is going to be paid in early 2015. The Internal Revenue Service is going to have a hard time policing this tax penalty for 2014. Employers are supposed to send the IRS a report with details about employee coverage, so the agency can determine who is uninsured and check whether the penalty is paid. But when the administration delayed the start date of the employer mandate to 2015, it also made employer reporting voluntary for 2014. As a result, the Internal Revenue Service will not have completely accurate data on people who are going without coverage for 2014. And interestingly, the IRS's enforcement remedies are limited to collect the tax. So the IRS cannot file a lien or levy a person's assets to collect this tax penalty. So it's allowed only to offset tax refunds to collect the penalty. Nor can it charge interest on the unpaid balance of the tax. So there's your update. Keep checking in, and you got my number right, 303-447-1626. Thank you.